So coming to question 40 of our previous year NEET PG question discussion series. It's an X-ray based and a clinical question. A 45 years old male comes with complaints of fever and cough for 5 days. On examination, he was febrile, tachypneic and had tachycardia. His examination showed right-sided crepitations and bronchial breathing in the right mammary area. His X-ray chest is as follows. What is the diagnosis? Always, even in an image-based question, don't directly jump to the image because the question may give some clue, the question may give some twist. So here there is fever and cough for 5 days and he was febrile, so some infection is there, tachypnea and tachycardia. So we are dealing with some infection of the lung, right? Some lung infection. So lung infection, maybe you can think of pneumonia, you can think of lung abscess, you can think of empyema. All these are lung-based diseases and disease duration is only 5 days. So a cancer-like disease is less likely. His examination showed right-sided crepitation. So we have to look at the right side of the lung. So there is some pathology in the right side. There is bronchial breathing in the right mammary area. If you remember the areas of the lung, I'll just give the summary of the areas of the lung. Supraclavicular, infraclavicular, axillary, suprascapular, upper interscapular. So if you remember the clinical based auscultation, if there is a problem in these 5 areas, then we can understand that the problem is with the upper lobe of the lung. The problem is with the upper lobe of the lung. Mammary alone corresponds to middle lobe. We know that the right lung has the middle lobe, left lung does not have the middle lobe. The equivalent of middle lobe of the lung is the lingular lobe. So if there's a problem in the mammary area during auscultation, the problem is with the middle lobe. All the other remaining areas like inframammary, we do not have inframammary, infraaxillary, the entire posterior thing like lower interscapular, infrascapular, stands for the lower lobe of the lung. So we understand that upper lobe is mainly in the upper part, supraclavicular, axillary, suprascapular. Mammary alone corresponds to the middle lobe of the lung or the lingular lobe of the lung, and the entire posterior, the axillary, the infraaxillary and the entire posterior infrascapular and lower interscapular stands for the lower lobe of the lung. So even though not very common in NEET, suppose if a clue is given, we can pick it up here. So here they are given there is a bronchial breathing in the right mammary area. We know that bronchial breathing, the most common cause is consolidation. Consolidation means there is a tumor or a pneumonia in the lung. So there is an infection causing right-sided and there is a problem in the right mammary area. So even before going to the image, we find that there is a right probable middle lobe disease. We can take that it is consolidation. So just reading the question for an extra 30 seconds can help us to diagnose easier. So we are supposed to look whether this is the answer. So we'll come to the image-based discussion now. So in an X-ray, especially a lung-based X-ray, how will you classify the lobe? So you can see this is the first strip, right? I'll use a different color. This is the first strip. This is the second strip, okay? If you draw a line at the level of second rib, first rib, second rib. So if you trace the third rib, it comes like this. Maybe fourth rib comes like this. So up to the second rib, the anterior part of the second rib, above this is called as upper zone. In X-ray, we call it as upper zone, not the lobe. From the second rib to the fourth rib anterior aspect, we call it as the middle zone. Not the middle lobe, it is the middle zone in the X-ray. Below the fourth rib, we call it as the lower zone. Okay. Because the lobar pathologies may vary. Upper zone may have upper and middle lobe pathologies. Middle zone also has lower and middle lobe pathologies. And lower zone usually means lower lobe pathologies. So just here to classify into the lobe. So I'll just erase this. So this probably is a middle and lower zone. Some opacity is there here, right? This is a fluffy opacity of the right mid and lower zones. If you see carefully, we can see some air within. If air shadow is seen, it means bronchus is open here. This point is very, very important because if air is present, we call that sign as air bronchogram sign. If air is present in a opacity, we call it as air bronchogram sign. Presence of air bronchogram sign means it is consolidation. Consolidation is pneumonia. Because if air bronchogram, this sign is absent, what does it mean? The bronchus is not open. What disease causes collapse of the bronchus? A tumor. A tumor will occlude the bronchus, so air will not go in, hence the lung collapses. So if air bronchogram sign is absent, in the same fluffy opacity, we call it as a collapse, or we can also tell it as a mass. So for example purpose, just remember collapse. If air bronchogram sign is present, it is consolidation. If air bronchogram sign is absent, it is collapse. So here we are having a right mid-zone consolidation, and it's not a collapse because air bronchogram is present. So I'll erase off this thing also. Now I told you lower zone and mid zone means either the problem is in the middle lobe or in the lower lobe, right? So from the options we ruled out the first one, right? Because option gives everything, middle lobe or lower lobe, so we cannot exclude. So how will you differentiate whether it is middle lobe or lower lobe? There is something called as Felson's-Silhouette sign. Felson's-Silhouette sign. The silhouette means the shadow. Silhouette sign says that in any opacity, if the hard shadow is obliterated, it means it is a middle lobe pathology. If there is obliteration of the diaphragm, it is a lower lobe pathology. The background is basic. We know very well that the lower lobe sits on the diaphragm. Middle lobe is closely associated with the heart. X-ray is only a two-dimensional image. So we are just making a guess. If there is an opacity which is close to the heart, definitely the heart border will be shadowed, or the shadow will be close to the lung opacity will be very close to the heart. That is called a silhouette sign. So here we see this shadow, this middle lobe middle zone consolidation is very close to the heart. It blends with the heart border. So this probably has to be a middle lobe. On the contrary, suppose if that opacity was very close to the diaphragm, it was obliterating the diaphragmatic shadow, it has to be the middle lobe, right? So from the clinical clue, we made out that this is probably a right middle lobe consolidation. And in the X-ray also, there is a right middle and lower zone opacity, which is silhouetting the heart. So this is a right middle lobe consolidation. Option A, right lower lobe. Option C is also right lower lobe. So those two are excluded. Of course, only when lower lobe is the doubt, we will discuss about apical or segment or posterior segment. In X-ray, it is difficult to say the segment. So at least remember this one. How will be an upper lobe opacity will be? Upper lobe is close to the trachea. So the upper lobe opacity or upper lobe consolidation will obliterate the trachea. Right? So you should remember silhouette sign and how will you made a diagnosis. How will a pleural effusion look? Pleural effusion is a fluid, so definitely there will not be an air bronchogram in the opacity. Pleura sits outside of the lung, so which means the opacity has to be peripheral. It cannot be a central opacity, right? If it is a pleural effusion, it should be peripheral, it should be outside the lung, it should be covering the lung. Sometimes we'll have that S sign. I'll show you if possible. And it is a homogeneous opacity. It should obliterate the costophrenic angle. Because it is peripheral, it is fluid, so it should obliterate the costophrenic angle. So in 2023 NEET, this is a 2023 NEET PG question. Some two images were based on pulmonology X-rays. So one was this one, another one was a right upper lobe consolidation. That clinical clue was that again patient was a smoker. So he presented with right-sided ptosis, he presented with right-sided anhydrosis, and there was right upper limb weakness. So this is a PYNQ tumor. So PYNQ tumor is obstructing the brachial plexus of the right side, causing upper lobe weakness, and sympathetic chain is affected. So there was Horner syndrome like features in the right eye. And image was right upper lobe consolidation, which was PYNQ tumor. So this type of images are very important. So we'll just go through some related images here. Now what is this? So from the image, first rib, second rib. So this is a right upper and mid zone opacity. Okay, it is not peripheral, it is involving the lung, so it is not a pleural effusion. And remember, pleural effusion can never be above. We can see air bronchogram, right? Some air is seen there. So there is an opacity with the air bronchogram. So this is definitely a consolidation. Now which lobe? Upper zone is usually upper lobe, there is no doubt. Plus here heart is also free. Diaphragm is also free. So this is a right upper lobe consolidation. This cannot be taken as a collapse, because if it is a collapse, air bronchogram will not be seen. PYNQ tumor usually presents with right upper lobe collapse. So the scenario may be given here is fever with cough, expectoration, etc. If you see closely, there is one opacity here, right? This is the costophrenic angle. You can see the left side. This is the diaphragm, the phrenic. This is the rib. This angle is the costophrenic angle. We can very well see the costophrenic angle in the left side. But if you see the right side, we are not able to see the angle, right? This is called obliteration of the costophrenic angle, which indicates that some fluid is here. So this is minimal pleural effusion is there. I told you pleural effusion will occur only in the periphery, right? So sometimes effusion will come like this. See, this is an effusion. Can you see? The opacity is peripheral. The opacity is homogeneous. It comes like an SC. So a peripheral homogeneous opacity obliterating the costophrenic angle. This is a pleural effusion. So this is a right-sided pleural effusion. This opacity is a bit different from the other opacity, right? Probably what happens is this pleural effusion is compressing the lower lobe of the lung. This is a lower lobe collapse. Why I am telling it's a lower lobe collapse? Because this opacity is obliterating the diaphragm, right? Pleural effusion will definitely obliterate the diaphragm because pleural effusion is just above the diaphragm. Suppose if the same opacity is given with the air bronchogram, we can tell it as a lower lobe pathology. If there is an air bronchogram, think it as a lower lobe consolidation. Or this could be a lower lobe collapse also, right? Since costophrenic angle is obliterated, this more likely is to be an effusion. Okay, so the best answer here will be it's a right lower lobe, right lung pleural effusion. Suppose if the costophrenic angle is free and the opacity is this side without an air bronchogram, the answer will be a collapse. If the same image is given with the air bronchogram, it is a right lower lobe consolidation. Think of silhouette sign. Now what is this? Again draw the rib, first rib, second rib. So it's a right upper zone and mid zone opacity. This is a homogeneous opacity. There is no bronchogram seen. So this is a homogeneous opacity. So what probability is there? It looks like a collapse. So this is the typical PYNQ tumor which I was telling you. Okay, PYNQ tumor, right upper lobe collapse. The history will be like a tumor, brachial plexus involvement. Now from this image, right upper lobe consolidation image, one extra finding you can make out. See, this is a bulge. This is a bulge. Usually upper lobe and middle lobe are separated by the fissure there. So this bulge is called as bulging fissure sign. Don't confuse with bulging tumor sign. This is a bulging fissure sign. Bulging fissure sign with right upper lobe consolidation. We can find out the organism also. It is Klebsiella pneumonia. Okay, Klebsiella pneumonia, the growth will be very massive. The consolidation will be very massive. So it will bulge the fissure. This is called bulging fissure sign. Bulging tumor sign is different. Bulging tumor sign is the same fissure which is having effusion. On giving diuretics, that effusion will disappear. So it's a sign of volume overload. And then what else can we have here? Suppose in an image, I don't have that image, there is a right upper lobe collapse with a mass in the middle lobe. Right? So there is a mass in the mid zone which is obliterating the heart, plus there is a right upper lobe collapse. It will come like this, the S sign. That's called as golden S sign. Golden S sign means there is a middle lobe tumor causing an upper lobe collapse. Okay, so this collapse consolidation is very, very important. So I showed you the image of middle lobe. Now what is this one? May look at challenging. So here the opacity is in the left side, correct? There's the left side opacity. It looks like the entire left lung is affected. There is no air bronchogram. So this is the left. Left has only two lobes, right? Upper lobe and middle lobe. This is definitely a collapse because there is no air bronchogram. This costophrenic angle is seen. So this is not a pleural effusion also. So this is a collapse. But can the left lung completely collapse? Definitely either the upper lobe or lower lobe should collapse. Here you should look at one typical finding. You can see this is the aorta, right? We can see one air lucency here. This looks like a sickle. This is called as left sickle sign. Left sickle sign. So this lucency looks like a sickle. Why this lucency looks like a sickle? Even when the lung collapses, that left-sided bronchus will be visible. So this is actually a left upper lobe collapse. Left lower lobe collapse will be easy to pick it up because it occurs in the lower zone. It will obliterate the heart, definitely. Here, there is an opacity, of course, but this shadow, that is tracheal shadow is seen as a sickle, which means the opacity is close to the trachea. So this is a left upper lobe opacity, left upper lobe collapse. This is called as left sickle sign, right? So I think most of the image-based questions can be diagnosed from this one.